Welcome to this high-yield explainer. Today, we're going to clear up one of the most common and, let's be honest, frequently confusing topics in gynecology. How to tell one vulvovaginal infection from another.
So let's jump right in. A patient comes to you with vaginal discharge. Is it a protozoan, a fungus, something else entirely? Nailing the diagnosis is a classic clinical puzzle, and you're going to see it all the time, both in your exams and on the wards.
Here's how we're going to break it down. We'll start with a very specific, localized infection. Then, we'll compare the two major types of vaginitis side by side. After that, we'll look at the lab tests that give you the definitive answer, and we'll wrap up with a super quick recap. Sound good? Let's go.
Okay, first things first, let's set the scene. The vulva and vagina have their own little ecosystem with natural defenses. But when things get out of balance, infections can move in. Our job is to play detective and figure out who the culprit is based on the clues they leave behind.
Now, before we get into the infections that affect the whole vagina, let's zoom in on a very specific, localized problem. Understanding what happens with the Bartholin's gland is a really great way to build a foundation for this whole topic.
So, what are we even talking about? Well, these are the Bartholin's glands. They're tiny, about the size of a pea, and their main job is to provide lubrication. But the important part is that they have ducts, and those ducts can get blocked. For your exams, just remember their location. Posterolateral, think 5 and 7 o'clock on a clock face.
And what causes these infections? A lot of people jump to thinking about STIs, like gonorrhea, but actually it's much more common to find these pus-forming organisms, like E. coli or staph. And pretty often it's not just one bug, but a whole mix, what we call a polymicrobial infection.
This little flowchart just perfectly lays out the whole story. It starts with a simple inflammation, or bartholinitis. If that duct gets blocked, you can get a buildup of pus, which forms a super painful abscess. Now, if it's not pus, but just the gland's own fluid that gets trapped, you get a Bartholin cyst, which is usually less painful. It's a classic pathological sequence. So, what's the key clinical takeaway here? When a patient comes in, you're looking for a unilateral, that means one-sided, swelling that's very localized and tender. They'll tell you it hurts to walk, it hurts to sit. This localized nature is what really sets it apart from the other conditions we're about to cover.
All right, let's move away from that localized infection and go inside the vagina to meet our first big cause of vaginitis, the protozoan invader.
And here it is, Trichomonas vaginalis. Take a good look. It's got this characteristic pear shape, and you see those little tails? Those are flagella. They're what make this organism motile, which is going to be a huge clue for us later under the microscope. And remember, this is a sexually transmitted infection.
So, what are the telltale signs? The patient will describe a discharge that's sudden, a lot of it, and often has a bad smell. The discharge itself is thin, kind of grayish or greenish yellow, and it has this classic frothy appearance. But, and this is probably the most high-yield point on this slide, look at the vaginal pH. It's elevated, way above the normal 4.5. That is a massive clue.
And this is the pathognomonic sign you read about in textbooks, the strawberry cervix. Now, full disclosure, you don't see it that often, maybe in about 10% of cases. But if you do see these tiny red spots, which are little hemorrhages on the cervix, you should immediately think trichomonas. It's a dead giveaway.
Okay, on to our second major cause of vaginitis. This one's completely different. It's not a protozoan, it's actually a fungus that, for many people, is just a normal part of the vaginal flora.
Meet Candida albicans. It's a yeast, and under a microscope, you can see these characteristic budding forms in something called pseudohyphae. The thing with Candida is, the problem isn't usually its presence, it's its overgrowth. This can happen when the vaginal environment changes, like with antibiotic use, pregnancy, or in patients with diabetes.
So, how does this present? The number one symptom, the hallmark, is intense itching or pruritus. It's often way out of proportion to the amount of discharge. The discharge itself is famously described as thick, white, and clumpy, like cottage cheese. And here is the critical difference from trichomonas. The vaginal pH is completely normal. It stays acidic, less than 4.5.
And this picture shows you exactly what we're talking about. You can see that thick, white, curdy discharge stuck to the vaginal walls. This is the classic image you should have in your head for candidiasis.
Okay, so you've taken a history, you've done an exam, you've got a pretty good idea of what's going on. But how do you confirm it? Well, this is where the lab comes in, because microscopy is what gives us the definitive proof.
First things first, you got to get a good sample. It's simple. You collect some of the discharge, and then you prepare 2 separate smears on a couple of glass slides. One is going to be for what we call a wet mount, and the other is for a KOH prep. Let's look at what each one shows you. Now this is absolutely crucial to understand. So for that first smear, you just add a drop of normal saline. That's your wet mount. The reason we do this is to see living organisms as they are, and specifically to see if they're moving. If you look in the microscope and see these little pear-shaped things darting around, boom, you've diagnosed trichomoniasis. For the second smear, you add a drop of 10% potassium hydroxide, or KOH. The KOH is amazing because it dissolves all the junk, the skin cells, the debris, leaving behind only the fungal elements. This makes it super easy to spot the hyphae and buds of Candida. Just remember, saline for motility, KOH for fungi. And here it is. This table is your ultimate cheat sheet. If you're studying for exams, this is pure gold. Let's run through it. pH is your first question. High for Trichomonas, normal for Candida. The discharge, thin and frothy versus thick and curdy. The wet mount, motile bugs versus fungi. And the main symptom, moderate itching versus intense itching. If you know this table, you're in great shape.
All right, we've covered a lot. Let's do a quick fire recap just to make sure the most important points really stick.
For trichomoniosis, just remember this simple formula. It's a protozoan infection that leads to a raised pH, a frothy discharge, and, if you're lucky, you'll see that classic strawberry cervix.
And for candidiasis, the formula is, it's a fungal overgrowth with a normal pH, that classic cottage cheese discharge, and the defining symptom is that really intense itching.
So, to wrap it all up, let's leave you with this final thought. A patient's vaginal pH comes back at 6.0. What should be at the top of your mind? Trichomoniasis, for sure. And what can you pretty much rule out based on that one piece of information? Candidiasis. My final piece of advice, always start with the pH. It's your fastest, simplest, and most powerful clue.